Welcome to Let's Crack NEET PG, the YouTube channel for Unacademy, our NEET PG division. And here you'll find the top educators, quality content, and you are assured a great learning experience. So my name is Chaitanya Mittal. I'm currently pursuing my MBBS from AIMS, New Delhi. And I hope you've already downloaded the Unacademy Learning app. In case you haven't done that, please go to the Play Store, download the app, and you will have to register with your mobile number. Then set your goal as NEET PG to access MBBS courses, and after that you will need an invite code to unlock the free plan. So you can use my invite code Chaitanya10 and get a 10% off on your plus subscriptions, and you can also unlock the free content. All right. So these are some of the top educators who are teaching live on Unacademy, and you can follow them there, right? And educators are supposed to make plus courses for all of you, right? So these plus courses are obviously paid courses, and you will need a subscription to access them. But to show you what the live experience feels like, we have free of cost special classes available on the platform. So even if you don't take a plus subscription, take maximum advantages of the free content that are being made by all these plus educators. So there are batch courses that are running. These are basically live classroom courses. So these are live batch courses that you can watch, and they will give you the live classroom experience. If you want to assess your preparation, there is an option for testing. We have special tests and weekly tests, right? And if you have any doubts, we have a doubt clearing feature now that is called an ask a doubt feature, right? So take advantage of all these three kinds of things, and with this your preparation will become one stop with Unacademy, right? So everything here is going to be covered, and we have the upcoming batches for NEET PG, for Next, for FMGE, and for INICT. So all kinds of batches we have. So if you are preparing for any of these entrance examinations, or if you are an MBBS student, or if you are a student studying for BDS or Ayurveda or homeopathy, and you feel that these classes are helping you, take advantage of whatever you can, right? And free tests are there for you to assess your preparation so that you can compete with a lot of aspirants for the examination, and that makes Unacademy the easiest way to learn for NEET PG online. We are giving you flexibility in terms of your schedule when you want to learn, what you want to learn. In terms of the language, you can learn in English, you can learn in Hindi, you can even learn in your regional languages, and you can watch the videos as many times you want. You can attempt the quizzes as many times as you want. So just go ahead and install the application. Take advantage of the chat feature there. Take advantage of the polls, which will help you compete in live quizzes, and you're basically having the ability to learn anytime, anywhere you want. So there are two kinds of subscriptions. There's an Unacademy Plus subscription, and there is an Unacademy Iconic subscription. In the Unacademy Plus subscription, you get access to the entire live experience. That is the live classes, the live tests and live quizzes, the batch courses, and you are getting access to a structured schedule which will help you streamline your preparation. Okay. And I already told you that the tests feature and the doubts feature make Unacademy a one-stop unique solution for your NEET PG preparation. As far as the Iconic subscription is concerned, you not only get access to Unacademy, but you also get access to our premium partner, that is Prep Ladder, which we have recently acquired. And as you all know, Prep Ladder is having premium video lectures for select topics, question banks which are updated according to the latest pattern, a rapid revision course, and the handwritten notes. And if you use these handwritten notes, it will be very easy for you to make your notes, especially if you are towards the end of your preparation. It will be very easy for you to compile all your preparation in one place, right? So all of these notes are printed hand colored, and if you buy them separately they'll cost you 7,000. Okay, so the Iconic subscription for 1 year will cost you 55,000, and if you just simply apply the referral code Chaitanya10, this will give you a discount of 10%, and this will cost you 49,500. You can also take the 2 year plan that costs you 69,300, and the 3 year plan will cost you 82,800. If you take the Unacademy Plus subscription, the 1 year plan is for 25,000, and the 2 year plan it is for 36,000, and you can take the 3 year plan for 45,000. All you have to do is use the referral code Chaitanya10, and again you are getting a 10% off. Remember, this referral code is applicable for any kind of course that you purchase, whether it be for NEET PG, or whether you are preparing taking a subscription for someone in your family preparing for NEET UG or UPSC. This is valid. Okay, so this is how you have to take the subscription. Just choose the plan, and you can apply the referral code. You have to enter my referral code and click on apply, and you can also apply credits for an additional discount, right? So that was about the Unacademy subscription. So now let's move on to today's video. So let's have a quick discussion now on the types of anemia. What are the various types of anemia that you should know about? So when you talk about the various types of anemia, the most important type of anemia, the most important classification is according to what happens to the RBC. What is the appearance of RBC under the microscope? Appearance of RBC under the microscope. So this classification we will do according to the appearance of RBC under the microscope. So there are some words that you must be familiar with, and we'll try to put those words into perspective. So it's on the basis of, there are two criteria. First is on the basis of size of RBC, right? On the basis of the size of RBC, there can be three categories, right? It can either be smaller than the normal size, it can be microcytic, or it can be equal to the normal size, that is normocytic, and it can be larger than that size, so that is macrocytic. So that is one classification that we will follow based on the size of RBC. The second classification to follow is the color of RBC, right? The color of RBCT, the color of RBC. And on that basis, it can either be pale, in which case you will call it hypochromic, in which case you'll call it hypochromic. It can be normal in color, which case you'll call it normochromic, right? And it's generally not hyperchromic, but yeah, that's the third terminology. So those are the various words that we'll be using. So it's very important that you guys understand these words. So if you have a look at this, what are the three main types of anemia according to this? The first type is macrocytic normochromic anemia. The second type is microcytic hypochromic, and the third type is normocytic normochromic, right? So microcytic hypochromic anemia is the most classical one that you will obviously have studied, and you will obviously correlate it with iron deficiency anemia. So what are the parameters in microcytic hypochromic anemia that you have to be aware of? So since it is microcytic, so the mean corpuscular volume is going to be low, and since it is hypochromic, the mean corpuscular hemoglobin concentration is also going to be low, right? So both of these are low. The MCV is less than 80 femtoliter and MCHC is less than 30. So these are the criteria that must be fulfilled. And this is classically seen in case of iron deficiency anemia, also seen in thalassemias and certain anemias of chronic diseases in very rare cases, right? The third thing is, the next thing is macrocytic normochromic anemia. So you've already associated macrocytic anemia to pernicious anemia, which is due to vitamin B12 or folate deficiency. So since it is macrocytic, the MCV will be more than 100 femtoliter, and the MCHC will although be normal, that is 34. If you talk about normocytic normochromic anemia, the RBC is absolutely normal in appearance. So MCHC is normal, MCV is normal. It lies within the normal ranges. But it is seen in case of, for example, hemorrhage. When there is blood loss, the RBC is normal, but the amount of RBC is reduced. Or it can be seen in anemia due to chronic disease or anemia of uh, aplastic anemia or hemolytic anemias. All of these anemias will have these characteristic findings. So if I give you an overview on the basis of that, the microcytic anemias, where the mean corpuscular volume is on the lower side, less than 80, normal is 80 to 90, 80 to 99, and the higher one is greater than 100. So that is microcytic. So this is seen in case of pernicious anemia, B12 and folate deficiency, iron deficiency, sideroblastic thalassemia, and certain rare cases of anemia of chronic disease are microcytic, and normochromic normocytic anemia of chronic disease, paroxysmal nocturnal hemoglobinuria, or hemorrhages, G6PD deficiency, hereditary spherocytosis. In all of these cases, you will have normocytic appearance of RBCs, right? So that is about the types of anemia on the basis of the appearance of RBC under the microscope, right? So thank you so much. That is about this particular slide, right? So thank you so much for watching the video, and I'm really thankful that you guys spent your time on today to watch this video. And do remember to hit the like button if you guys like this video. That's a really powerful motivation for any educator. And do drop a comment. That's an even more powerful motivation. And for your benefit, do remember to subscribe to the channel Let's Crack NEET PG, and you will get access to all subjects that are being made, and we are giving you the live classroom experience on YouTube. Okay. And you can also subscribe to our Telegram channel. The link of the Telegram channel is also in the description. It's with the same name. So faculty keep updating their various lectures here. So stay subscribed to that also, and do track what is the content that is coming on a particular day. So these are the referral codes Chaitanya 10. You can use this to unlock free plan, right? You can use this to unlock a free plan, or you can also use this to purchase a subscription. You will get a 10% off on your subscriptions. And do remember to hit the bell icon for notifications. Okay. Thank you so much, guys.